Hi, guys. Thank you so much for coming back to the segments here at Holy Cross Ministries. Today, I have a very good special friend of mine, a co-worker from Holy Cross Ministries, and we're here to shed a little bit of light of what she does at Holy Cross. And not only is she working for us right now, but she has been working with the community for centuries. I mean, we're talking about many years in the making. So she has so many resources, so many connections, within the community. And I wanted to bring her along today to talk about a little bit about herself. But not only is she an amazing person, but she is a great advocate for the Hispanic community. And right now, we have recently launched as well a program. It's a medical debt legal advocacy, and Carmen is actually one of the first ones in the state right now of Utah that will be helping those that need help with medical bills and medical debt. So I wanted her to talk a little bit about that and answer some questions that I have for her about the program so you guys can know what this is about. So I'm going to turn the time over to Carmen and have her tell you guys a little bit about herself. Okay, go ahead, Carmen.
Hello, everyone. So this program has just recently started. It's been in the works for quite a while, but we finally got it started the month of May of this year. And the program actually it's a really good program that helps everyone who has been experiencing medical debt. There are so many people out there that receive medical bills, receive very large, whether it be medical bills or dental bills, any kind of bills that they're not able to pay due to income. Many times they're not able to even have any type of a health insurance. They're not sure how to apply for a certain kind of a health insurance. So when people come to us, they're looking to get us some kind of assistance. So the program, it's part of the Innovation for Justice, and it's a cross-jurisdiction legal innovation program that started. It's with the University of Arizona, the College of Law, as well as the University of Utah, the School of Business. And so under the Supreme Court, they've approved a limited scope of services that we're able to assist with clients that are coming to us. Many times they're coming to us because they just have a multitude of medical debt, and they're not sure how they're going to pay for this medical debt. We try to link them up with services. One of the first steps is if they are qualified to apply for Medicaid or emergency Medicaid, we can do that as one of the steps. But one thing that is really important to know here is that this program, being that it's new, we try to let people know right from the get-go. One of the services that we offer is not only limited legal scope of legal advice, but we are not able to attend court with the client. That's one thing that it's beyond my scope. But we are able to assist them through the process. Normally in this process, it's very lengthy, very confusing, and very frustrating for a lot of people. So I help them through that process.
Got it. That's awesome. Yeah. And again, this is something that is just a recent new program that has launched in the state of Utah. And it's an amazing thing that we're able to actually have you get certified for this to help those people. Because as we know, medical bills are very complex. There's many obstacles that they unfortunately make the clients or the patients go through, and we are here just to kind of facilitate them in making that process a little bit easier, because imagine just trying to go through all those obstacles, and what might seem easy maybe for us or for some clients, it's not easy for for others. And the medical bills and the whole process of the financial assistance can be very complex. So we try to make it as easy as possible here at Holy Cross. So Carmen, let me ask you a question. Is there any cost to this program for these people that are wanting to come to you for the assistance? Any requirements or anything that they need to pay for, or?
No, so actually, our services with the Medical Debt Legal Advocate Program is completely free.
Okay.
There is no immigration status that they need to comply with either. Our doors are open to everyone and to everybody. We help to the best of our abilities, and we pretty much take them by the hand and walk them through the entire process from beginning to end. There may be times where families or individuals may be going through collections, because after a certain amount of time, those bills will be sent to collections. Many times, many of the families that we work with, they move quite often. They don't send a forwarding address. And that is very important to do, to send those forwarding addresses, so that any type of billing or any type of mail, important mail that comes in, that they can follow them wherever they're moving to. Unfortunately, that doesn't happen very often. So these bills will not go away. They will keep, the time keeps ticking pretty much, and they eventually are sent to collections. If they're ignored the collection calls, then they can get a judgment filed against them as well. At that time, they start to accrue interest. They start to, they're going to incur attorney costs, attorney's fees, and of course, they're accruing interest depending on whatever their interest rate is for the facility that is having that bill currently, right? Yeah, but we don't charge anything. Our fee is nothing. It's zero.
Got it. I know you did mention earlier that you are not able to represent them in court whatsoever. So just to touch a little bit on that, what is exactly the scope of your work? So what it is that you talk to them about, just a little bit of what it is that you will eventually work with these clients.
Okay, so during an initial visit, most of the time they're contacting me via text or via email, or just a phone call, meeting messages. Once I get that phone call, I just get the specifics pretty much, because everybody has a story, right? Mm-hmm. Everybody has different medical debt, different situations, different incomes, and I have to kind of decipher through all of that. I make sure that, between me and the client, we talk about the billings that they have. I total up those billings. We look at options that they may have. There are times that there are certain clients that they can qualify for either a Medicaid retroactive, because they can go back 3 months. Or possibly they can qualify for emergency Medicaid, and they can also do retroactive again, 3 months. If for any reason that they do not meet the guidelines from Medicaid or from DWS, then we go right into putting the applications in for the financial assistance directly through the medical facility. And that's important, because many times that's pretty much the first step. They requesting that they try to seek some kind of financial assistance from somewhere, right? A family, a friend, a church, and the big one is Medicaid. So I always try to have them, ask them if they have current health provider. If they do not, then possibly if they can qualify for Medicaid, we put in a Medicaid application in. But that's pretty much the first process. The first step is getting to know the person, getting to know their situation, requesting that they bring in all their medical debt that's in question, or if they have a judgment against them, bring that information in as well. Or if they have a collections agency that's sending them documentation, send it in as well. I try to get every piece of information
Right.
so put this story together to best help them, because it is a process.
Mhm.
By the time they come to me, they're in they're just beyond. They don't know what to do, or they've called everybody and everybody's shutting doors, and or there's a cost attached to the
Yes.
service that they're getting.
Right.
When they come to me, they're they're very grateful and they're very happy to know that, first of all, we're not going to charge them. Second of all, that the person that they're talking to is going to be the same person helping them from the beginning to the end. And that is it's very helpful for the client, because they know that I'm the person they're going to be calling all the time or speaking to all the time and helping them with that process. It's not going to be they're going to be calling and somebody else is going to be turning it over and then having to explain their story several times. So that's the first process. Once we go through that first process, then we start. I normally get the accounts down from the medical providers. I get them all organized, and then we start calling these medical providers to see what is owed. You'd be surprised. There are times, like I stated, many times the families move and they don't put a forwarding address, and so the providers cannot get in contact with them, or they change phone numbers as well. That's another thing. So as I'm working with them, then we contact those medical providers and say, hey, these are bills that were sent to collections, and we want to find out how we can get an itemized statement of all these billings that are stating that are owed, because we need to know. And I can tell you, it is a process. You can be on the phone with medical providers or Medicare or Medicaid for hours, trying to decipher through what was done, what was submitted, what was not submitted, what was paid, what was not paid. It's very time consuming, but it's something that has to be done. And the majority of families, when we have any kind of health care or health insurance, we just automatically think that, oh, I have medical insurance. If I go to the doctor, they're going to pay for it. That's not necessarily so. They have to look at if it's an in-network provider or an out-network provider. They have to look at, what their deductions are, what their co-pays are. They have to look at a lot of things. And many families, they don't take that time to do that because they're busy working, trying to support their families.
Right.
And you'd be surprised how many people, not only here in the state of Utah, but across the nation, there is so many people that have medical debt. I mean, in 2022, they did a national survey on healthcare debt, and they found that 100 million Americans had medical. And many times it's not just the medical debt; they also may have dental bills. They have optometrists, ophthalmologists, things like that. So they have a lot of debt that they're trying to take care of, and there's nobody to help them.
Yeah.
And so this program that started, this is something actually that Holy Cross Ministries has been doing for a while. We do have a lot of wraparound services, but specifically in our community health worker program, our Promotora program, we help anybody who's seeking help. Okay. And, again, this program was added on recently because the need is there. There's so many barriers that so many families encounter, not only just maybe a language barrier, but just understanding the very difficult and complicated medical process for all these billings, codes, co-pays, deductions, things like that not everybody understands. And so by doing this program and helping families, we call together. And so I have a set of questions that I would normally ask, because when you're calling, you have to have those specific questions because you need to help that client, right? And sometimes we have our clients that they're trying to give the whole story, and they don't really want the story. They just want to know the dates of service.
Yeah.
What's the name of the doctor? What's the name of the medical provider? And
Yes.
and how much is it, or how much they paid, right? And when was something active? When was your Medicare started? When was the Medicaid started? What was the date of service, the active date of service? When did it end? When did you switch to another provider? Those are very specific things that we need because that is going to determine whether that medical provider or health insurance is going to pay for those bills if it's within the scope of the time frame that they have active, right? So it's a lot of challenges.
Absolutely.
But it's very, very rewarding because we're here to help individuals. We're here to try to alleviate all the debt that they're incurring, and helping them to understand what their options are. Because a lot of times they don't know what they have options. They're just thinking they're going to send me to collections, and what do I do? My credit score, and some people don't even think about the credit score, but this actually does affect your credit score. And eventually, if it goes to collections and it goes to a judgment against you, that will affect your credit score. And there also can be garnishments, and people are not aware of that. So this is where I try to, right from the get-go, during our initial visit, I review with them things that can happen if this is not taken care of, or what their options are, and then review, their debt with them.
Absolutely. Thank you, Carmen. Yeah, that's everything that you have said hit the nail. Definitely. I myself have dealt with, some clients where we have just been trying to help them with medical bills, and there's many obstacles and barriers that we have to go through. And also there's sometimes just a lot of miscommunication that we kind of just have to just, understand and kind of just try to get to the bottom from the beginning. And that takes some time. It's definitely time consuming, but again, it's rewarding. I know you have helped, plenty of clients with bills that are hundreds of thousands of dollars, and I can't even imagine how a person would feel afterwards. So thank you. And one last question about this: is there any kind of citizenship status that the clients need to have?
Actually, no. We, like I said, our doors here at Holy Cross Ministries, they're open for anybody and everybody who is seeking help. Our doors are open for everyone. We don't look at immigration status. We don't look at any of that. Unfortunately, with many of the programs that are available, many times they hit those barriers, right? Where maybe the parent is undocumented, and sometimes even the kids are undocumented because they're fleeing from a country that has not been taking care of their people, and they come here for a better quality of life, just like we all want a better quality of life. So, our doors are open for everybody, and of course, when I'm working with clients, when I find out about whatever status of immigration status they're at, I work with them at their level. And so by working with many different organizations and agencies, I'm able to help them to kind of direct them as to where we can go for whatever kind of assistance that they may need. The biggest thing here is that, there is really a large justice gap. And mostly this justice gap hits people of color, people that are, low income, or that are struggling families or struggling individuals just trying to make ends meet. And these are the people that run into lots of not only medical bills, but they run into a lot of things, a lot of legal issues. And because of the cost factors to try to get an attorney, it's very costly. I feel that because they started this new program, It is extremely helpful and useful for the many communities that we service. And at the same token, it helps people to give them a way to get some type of legal service or some kind of help with a process to help them go through the channels, right? Because that's what it's about. They have to really go through these channels, and if there's no one there to help them or explain to them, then they struggle, and that's when things happen in a negative way. They have, it affects their credit score, it affects a lot of things, and so that's where we come in to try to help.
Absolutely, Carmen. Thank you so much. I really appreciate your time. You have shared some very, very useful information that needed to be said. Also, and so clients can also get to know Holy Cross, because we are definitely a wonderful organization. Like you said, we don't have a race, color. It doesn't matter if you're blue, pink, yellow, purple. We help everyone, and we do it from the bottom of our hearts. We have very good people at Holy Cross. So again, thank you, Carmen, for your time. Before we head out, I want to share that Medicaid reviews are back, guys, and it's very important that we update any information, any missing phone numbers, or if you have changed address. They need to make sure that this information is updated in case they needed to get in contact with you, or any recertifications coming your way, they go to the correct place and it's not lost somewhere in the mail. So I wanted to share this quick flyer with you guys so you guys understand. You have one less thing to worry about. For parents to worry about, please make sure that you have your kids get child checkups, as well as vaccines, dental visits, mental health care, and more. And all of this is covered by Medicaid and CHIP, as well as I wanted to share some of the annual income and what are the qualifications for you to qualify depending on your family size, okay? If you are needing help recertifying for Medicaid, we here at Holy Cross would love to help you. And again, 3 things to keep in mind is to make sure your contact information is up to date. Check your mail for any letters, for any recertification, and please complete your renewal of Medicaid if you do get one, okay? However, if you don't get one in the mail and you feel like it is time to recertify, here at Holy Cross, we will be more than happy to help you do that and help you make the process easier, okay? So again, 2 of the ladies that are great at doing this, please contact either Stefania Suarez or Carmen Cardenas here. And here are the phone numbers. And if you guys, going back to the program, I wanted to let you guys know that if you need to get in contact with Carmen for her legal program, please contact our manager. His name is Carlos, and his phone number is 385-257-2423. Just so he can refer clients to Carmen, okay? So thank you, Carmen, and thank you everyone for watching this. Hopefully this information was helpful and you guys can get some good insight, okay? Have a wonderful day. Thank you so much. Bye. Thanks, Carmen.